go a bit rogue here. There's a lot about AI and interoperability. I'm not going to speak about any of that. So Ben Rhodes will come up and speak a bit about that, but I'm going to speak about the service more so. It's my pleasure, and thank you for InterSystems for the opportunity to share how we are successfully developing healthcare virtually across Australia. My name is Amy Hill, and I'm the Commercial Director at My Emergency Doctor. With over a decade of leadership experience in healthcare, I currently support multidisciplinary teams across the business and manage anything from strategic business planning, clinical models of care design, to the implementation and ongoing management of our customers. I'm joined here today by Head of Technology, Ben Rhodes, whose 20-year technology experience spans through startups, multinational roles, and developed through C-suite. Ben has been with My Emergency Doctor for the past 2 years, leading our strategy to scale via technology innovation enhanced by clinical workflow integrations. Together, we will work you through who we are, what we do, and how our virtual board round service is transforming patient care. Connected Medical Solutions, or My Emergency Doctor, as you will probably know us better as, is an Australian medical organisation. Unlike everyone here, we are not a technology company at core. We are a service delivery organisation that's delivering services across Australia. For those unfamiliar with My Emergency Doctor, we were founded back in 2016 by Dr. Justin Bauer, an emergency physician who saw firsthand how many patients were presenting unnecessarily at the local emergency departments, often because they had no other access to timely medical support. Together with a group of fellow emergency physicians, Justin built a telehealth model designed to provide care at home, reducing pressure on emergency departments while providing patient outcomes and experience. One of the most innovative services for My Emergency Doctor to date is the virtual board round service. This model was designed to provide real-time senior clinical support to hospitals, particularly during after-hours periods. Through structured, scheduled virtual ward rounds, each session connects a emergency physician, with a hospital team to review active patients in the emergency department, discuss management plans for the patient, and make rapid, informed decisions. The objective? To improve patient outcomes, better department efficiencies, and strong clinical supervision and education, more importantly, for the junior staff. From an operational standpoint, the process is simple. Our clinicians and the client connects through a secure web-based link, initiating a video call. That allows two-way communication and live visibility of the department. While the facility sees our physician, our doctors have full overview of the local emergency department. This enables direct input into triage, patient allocation, and clinical management. At the conclusion of each session, a clinical report is shared with the facility, summarising each case discussion and supporting continuity of care. This service has been transformative for the hospital in metro, rural, and remote areas, and continues to grow. It's now time for me to hand over to Ben, who will take us through the technical architecture and workflow integrations behind this service and how our partnership with InterSystems enables safe, seamless, and scalable virtual care across the network.
Cool. Thank you, Amy. So, as Amy said, I'm now going to expand on some of the tools that we use to support the My Emergency Doctor services, particularly including the board round service. So to start with, talking about the board round tool, obviously a very clever name for a tool for the board round. It's on an emergency service overnight, there's no senior clinical doctors, and so therefore we provide that doctor who's going to walk the junior doctors through a number of the services. In order to do that, they need to have the right information at hand. So therefore, we have some integrations that need to be set up to provide the doctors with the necessary information. Because obviously, you don't want manual intervention where doctors are having to transcribe patient demographics and all of those basics when you can do it electronically via integrations. So the board round tool is designed for our doctors to have real-time visibility of what's happening across the client's emergency department. It provides up-to-date view of the patients, including their demographics, their presenting complaints, key observations, etc. This means that the doctors are always working on the most accurate information and in a timely fashion, which leads to better coordinated care. Now, if we remove those burdens of the unnecessary documentation, it makes the clinical professionals much more focused on the care that they can provide. And then at the end of the consultation, we can then send that documentation back, again via transfers through integrations, just makes it far more seamless and provides the up-to-date information that the doctors need to then provide their care. So before I get all the way into the detail of our case study, just talking at a high level, just to talk about interoperability within healthcare. So I think most people in this room who've been in healthcare or health tech for a while know that information sharing can be challenging. As an industry, it's sometimes lagging behind in those areas, but in the last few years, a lot of steps have been made to improve in those areas. For example, only about 22% of healthcare leaders surveyed in 2022 said that addressing interoperability and data standards would fully enable them to use health data, whereas most hospitals can send their data electronically, only about 3/4 actually integrate fully within their EHR. The reality is that the technology is there, it's just that the adoption isn't. And this is getting better in our metro areas and larger scale hospitals, but in the regional settings where we work, it's often lagging behind with the technology being quite outdated in some scenarios. As we've spoken out the front about AI and what can happen with generative and all of those nice things, and we talk about all the new possibilities, yet probably anyone here who's in a regional setting will realize that day to day we're still talking about faxes. So it's nice to be aiming for the high picture, but the reality is in the regional place, it's often you've got to meet the customer where they are. And that's just the reality. Often it's based on capital costs, it's based on skills resourcing, the facilities just aren't there. And so that's something that we're hoping to be able to change. The large scale projects for statewide solutions, we heard about the NT, a lot of people here will know about the STPR. They're making a big difference because they are providing a solution that will happen in the metro and be pushed out to the regional areas. But before then, a lot of these smaller scale sites just don't have the possibility. And that's based on the idea of the costs and the setup costs often being perceived as being out of reach. And for a lot of those businesses and small places, the IT department is really the person that knows the IT password. So the idea of having a full-time engineer who can run a hosted solution or integration engine is just always going to be a bit out of reach. So onto our case study. To set the scene here, as I've mentioned before and as Amy mentioned, we have many existing customers and we do have integrations in place for a number of these services that we provide. The integrations provide us with demographic information and clinical information, but in most of these cases, it is flat file transfers. HL7 and FHIR is a nice idea, but it's just not there. The sites operate in an environment where resources are stretched and often funding is stretched, so our approach to integration needs to be both practical and adaptable. The amount of times where we start a conversation and we'll talk about FHIR or HL7 and everyone in the room is quite enthusiastic, but then when it gets down to the reality of who's going to do the work and what's available on both sides of the conversation, it often scales back down. It can often go as low as a fax and an email, but normally we can find something in the middle, which is some kind of file transfers that go back and forward. Not ideal, but it gets us what we need to do. And so therefore, it's about meeting the customer where they're at, and then hopefully through our relationships, we can build up the appropriate projects that will enable them to move up and us to move up, and we can progressively work together. And as a business, HL7 has certainly been on our radar. It's something that we wanted to do, but without the right project, it's hard to justify the costs to go out and build all these skills and build these projects if you don't have an appropriate project to do it. And it's not through lack of interest, it's just not finding that right customer or that right project that will do it. And so rather than pursuing it just for its own sake, we were waiting until the opportunity came along. Hence, we started working with Bankstown Hospital, was the hospital we were working with in a metro setting. And when we came along and had the conversation with them, we spoke about HL7, and it wasn't just an opportunity or a desire, it was an expectation. So it switched around from us leading the customer of HL7 being great to the customer leading us saying, this is what we need to do. And so we needed to be able to exchange the data efficiently, securely, and in real time. And so this was both to meet our needs, but it also significantly improved the quality of our service, because with real-time data transfer, you can get better information, higher reliability, less duplications, etc. And so therefore, the benefits that we were going to be able to see was a faster, more reliable data exchange, reduced operational friction, a more seamless experience for the hospital staff and our staff, and importantly, it would be a future-proof foundation for the next generation of customers. To move forward, however, we also needed to acknowledge where we were. We're a clinical services company, and our IT team, our main job is to partner with other companies and other services, such as for our telehealth platform, for our electronic health record. We don't build it ourselves, we outsource that, and then we use our team to bring those things together to provide what we need. So in this scenario, we didn't just need a new piece of software, we needed an actual platform that could help us through that. And so we needed to recognize as well, we needed more than just a platform. We needed a lot of other skills. So we didn't have any HL7 experience, we didn't have a platform, and we didn't have a whole lot of time. So we needed to get there quickly. So we needed a solution that could give us an enterprise-grade interoperability without a heavy operational overhead. We also needed a solution that could be hosted in the cloud to meet our cloud-first approach, and also it needed to meet all of the security standards. And again, a short period of time. As you can imagine, setting those things up from scratch is not something you can do overnight. So we needed to find a partner and a platform that could meet those needs. In order to make the decision, we did our due diligence in the market, spoke to all the providers out there. I've worked with InterSystems a number of times over the years, so they were clearly on the list, but we made sure that we compared all the products in the market. We focused on product features, price, support standards, and time to go live. And so after a few conversations with Andrew, Steve Pisani, Kirsty to get started with, InterSystems was a clear choice for us, and they introduced us to their product, the Health Connect Cloud. So Health Connect Cloud could deliver the exact things we needed. It was a secure cloud-hosted environment, which meant that we didn't have to set it up. It was already there. It was managed by InterSystems. The speed to deployment was going to be there. It's built on top of a clear integration engine that's designed to handle HL7 and FHIR standards. And we knew what InterSystems were capable of from a support point of view, because I've worked with them before. And if anyone's worked with InterSystems, you're aware of what they're like and how they treat support and their customers. And importantly for us in the project, the price was very much in scale to what we needed. And this wasn't just about solving a technical challenge for us. This was about accelerating our maturity as an organization. We didn't have time to build the HL7 expertise. We certainly didn't have time to build the infrastructure and make it meet all the standards you would need to be holding clinical information in the cloud. And was also well out of budget to do those kind of things. Because reality is we didn't want to build the bus, we just wanted to buy a ticket. And I think that's an important thing to remember. I don't know how many people here would be able to say how many times you've been halfway through a project and you realize you're building the full bus when really all you wanted to do was just buy a ticket to where you needed to go. And so, Health Connect Cloud allowed us to stand on the shoulders of a proven platform with the support of a world-class team. Once the decision was made, things moved pretty quickly. InterSystems, again, having that larger team, was able to separate. They had their cloud services team who worked with the hospital, were able to get the handshaking and all the communication back and forward. And then with the rest of my team, worked with Steve, Juanito, and Nicole, and we started having the meetings with the customer. And so InterSystems was operating with us in those meetings, having those conversations, and even that, having those skills was part of the building confidence with the customer. So if I'd gone in with, I could have got a free option of integration services in the cloud and tried to build it from scratch. But if you come in with an existing partner with existing skills, it makes a big difference to the confidence on the customer side of who it is that you're working with. And so we were able to build out a solution which was configurable and scalable, met the immediate needs of the project, but was also able to build on the foundations for future projects which we could work on. and from day one, it's been very reliable. At this point in time, you might be wondering what it was how we got to this stage, but it was just through that partnership and all of that work that we did together. So then, since going live, often the conversations I've had here with InterSystems people, they're asking, how's it going, how's it working? And the reality is it's set and forget. The conversation pretty much is, it runs every night, it does what we need it to do, and we don't really have to do that much. So that's kind of ideal for us of when you've got a solution like that, is it does what it needs to do. We've built in the automated alerts and monitoring, so if there is a problem, we get notified, we can action it. If we need support, we reach out to InterSystems. They've been very good in providing us the support we need, but also helping us build our knowledge. So rather than just a standard ticketing system, I don't know how much people have worked with InterSystems support, but their philosophy is always the first person you talk to should be the last person. So rather than going through 3 lines of support, talk to one person, they can usually solve your problem. And yeah, in short, the system's delivered on the reliability and the stability that we set as our goals. And as part of that, it's worth mentioning, I'll go into a bit more detail later, but we also work with Fluffy Spider Technologies, because as much as InterSystems was there to help us get started, we didn't have those skills I mentioned, but through the InterSystems network, there's a lot of partners that you can work with. And Robbie and his team, Alan, have been able to help us set up, so that way as we scale and as we need more work, we've got the partners to work with. So now back to Bankstown, and I'll go back to Amy's side of non-technical for a little bit, but just to talk about the outcomes from the project. So on completion of the implementation at Bankstown, they've been able to see some significant improvements at the emergency department level. So they saw across the board improvements from patient flow, KPIs, and clinical outcomes. They saw a reduction in the treatment and transfer of care. They've found that their ED waiting times are significantly quiet by 7 a.m. They no longer have patients waiting until the morning for that clinical senior physician to come on board and clear the backlog. They did not wait outcomes were down by 50% during the overnight periods, and they also saw a reduction in the length of stay and time to clinician. On the clinical side, there are fewer after-hours adverse events and a decrease in unnecessary investigations, which result in cost savings. As a client, they've been very happy with the outcomes we've been able to achieve with that service. So now, looking to the future. For us as a business, this project has been a significant step forward in up-leveling our technical capabilities and also on our technology roadmap. By implementing Health Connect Cloud, we've future-proofed our business for both HL7 and fire customers. We've established a model that can easily scale across new sites and hospital networks, and laid the groundwork for integrations with a single digital patient record, or the SDPR. For those in New South Wales, you'll be well aware of that EPIC project. EPIC being the company, not Epic being it's EPIC. Although it's probably both. In fact, one of their first customers is actually going to be the local health district is going to be it's our existing customer. And so that current customer has a data file exchange, which is very much flat files back and forward. It does the job, but it has very limited capabilities in what it can do. There's a lot of data replication, there's duplication, there's delays, etc. But now, when we had our first conversation with SDPR, instead of saying, yes, that's a thing that we might be able to do, we can say, yes, we're ready to go now. We have fire capabilities, we have HL7 capabilities, and we're ready to start working with them straight away. So this is a great step forward for that customer, because once they get up to that level, it will improve our quality of services. We'll be able to do real-time data exchanges, and then also from there, we can now step up to the next thing. Obviously, anyone in these projects, you do like for like to start with, but then we can integrate further from there with HL7 to be able to do imaging, results, all of those kinds of things, which we can't do right now. So even though we're a small team and we have HL7 compliant now, we do get the best of both worlds by being able to partner with the partners that we've got. So now with Fluffy Spider Technologies, ourselves and InterSystems, we now have that ability where we can provide the clinical services, and we've got the partners that can give us the technology for hosting in the cloud, or the services deliver those integrations that we require. So then, in summary, for the lessons learned, there are a few key things that I wanted to share. So the first one is just knowing that you don't need to build everything yourself. Cloud-based interoperability platforms like Health Connect Cloud can take the heavy lifting. It allows you to focus on delivering value to patients and to your clinicians. It allows smaller organisations such as ourselves and service-based organisations with smaller IT capacity to be able to deliver at speed and with reliable solutions. Secondly, it's partnerships matters. And so therefore, those partnerships are both between us and our clients and also us and our partners, because having the right partners matter. Those who understand your business goals and share your sense of urgency can make the big difference between success and failure. Because the only thing worse than a bad integration is a bad partner who thinks that next week can sometimes be next quarter. And finally, future-proofing is not a luxury, it's a necessity. As digital health continues to grow and real-time data exchange becomes the norm, especially as we're talking about AI, the more quality data you have, you need to invest early. You need to have scalable integration frameworks, which will pay dividends down the line. And that is it. So thank you for your time.